Now, South Africans are going through many emotions as the 21-day national lockdown starts sinking in. As much as there's commitment to help government in the fight against coronavirus, some feel that being confined to their homes is too much to bear. To help us understand the psychological impact of the lockdown, we're joined via Skype by Bradley Daniels, who is a clinical psychologist. A very good afternoon to you, Mr. Daniels. Thank you so much for joining us. Just start off by telling us what the psychological impacts are of being in a lockdown, with some parents complaining about having their children to entertain 24 hours a day as well.
Thank you very much for having me on. I think we must start off by saying that this is business unusual at this point in time. It is a very difficult period for the nation, in fact for the globe. We're having to do things in different ways at this particular time in South Africa and around the globe. So many of us are in shutdown now. It's day 2 of shutdown. And I think what people are going to be experiencing is a big deal of suddenly having our freedom of movement limited. Now, this is almost similar to being in a similar environment as being incarcerated, although it's not quite an incarceration, but the same kinds of psychological stress that we expect from people who are, found incarcerated or in confined setting, they will have a very stressful experience which will have a negative impact on their mental health.
And then how can you advise our viewers to actually begin to deal with some of these stresses that they're not used to facing on a day-to-day basis?
So the first thing is I must reinforce that everyone has to take the shutdown quite seriously. It's important that everyone stays indoors and limits movement because one of the things that we are very clear about is that the viral spread becomes greater and more riskier to us as a country the more movement we have. So that's the purpose of limiting people's movement. It's not that government is intentionally trying to create additional stress for people. In fact, we want quite the opposite, because we know that positive mental health or good, robust mental health is going to be assisting people to have a better fighting chance in terms of protecting their immunity. So what people need to do is then just stay calm. Some of the ways that I found useful sharing with some of my patients in my practice is around them staying calm using things like mindfulness. So just being mindful about staying in the here and now without judgment. Using, for example, meditation. This morning I was privileged, and I use the word privilege particularly because I realized that as we are now working online for many things, that excludes a lot of people that are sitting in lower socioeconomic brackets who don't have access to data for that matter, or to be able to have resources to, for example, I this morning did a online yoga session with a group of other people virtually. And that won't be open to people who do not have the economic means to have data and have to have Wi-Fi connectivity. So we still have to do the best that we can with what we have. So mindfulness is a tool that anyone can use. Both the haves and the have-nots will have access to mindfulness as a tool. Meditation is really simple. Sometimes in the form of just staying connected to the breath, and we can actually just demonstrate it quite quickly. It's just staying connected to the breath and the here and now, and simply just allowing your mind to just be connected to the breath. If you practice that, even if it's just for 3 minutes, it's going to start to just reduce the level of stress that you're experiencing in your own body. So we have to, as psychologists, find very simple ways to be able to support both government and to support our individual caseload to be able to get through this particular point in time. I want to also take the opportunity to say that this is the point where, as psychologists, we really have to urge governments and other members of the multidisciplinary medical team to really start tapping into the knowledges that we as psychologists hold the key to, such as behavioral knowledge and behavioral change knowledge. And this we already saw. We had experience with this already when we were working with the HIV/AIDS pandemic. So I think it's important that we start to realize and say to government and to say to the president specifically that we are here. We are here to support. We have to understand COVID-19 as a biopsychosocial phenomenon, not just the biology. And particularly in a country like South Africa, where we have such structural inequality, which is still remnants from apartheid, where the virus itself doesn't discriminate amongst people, but the biopsychosocial impact is going to be very different across different social strata. So we have to get that message across.
And Mr. Daniels, also on the issue of maintaining relations, I mean, as human beings, people are used to being around others and socializing. So during this period of isolation, how then can they be able to stay in touch with their friends without physically going to see them?
So exactly as you and I are doing right now. So people have to use virtual platforms to be able to stay in touch with one another. So the word social distancing is a bit problematic because it creates the wrong sentiment. What we're looking for, actually, we're looking for physical distancing. And if I stretch my arms out, that is physical distancing, ensuring that if you are going to have, even in your home, if you're going to be in the same space with somebody else, that you have this kind of distance between the two of you, just to avoid the risk of spreading the virus. However, we actually need at this point social connectivity. We need to be connected to each other virtually, that is. So to the point where exactly families, in my own family, if I can use an example, you know, the level of connectedness seems to be deepening with everyone just checking in that everyone is fine. We have older members in our family who may be a higher risk category, but we may also have younger people who could be at risk for various other reasons. And just staying in touch with each other virtually. What I do want to make sure is that people understand that what the shutdown means is that it doesn't mean you can quickly pop into your neighbor. It doesn't mean that you can quickly pop in to go and see your mom if you don't live in the same house as your mom, because this unfortunately then completely defies what we are trying to achieve with the shutdown, which is we're trying to stop the shuffling of the virus from point A to point B. I was very disappointed when I saw on Thursday the number of people that in a panic were moving around from one province to the other. And really, even though I understand the psychological need that people wanted to be connected to their families and their loved ones, but at the same time, they were creating such a risk for everyone else in terms of taking whatever viral epidemiology that they have from one province to the other, making it much more difficult from a public health point of view for government to be able to really fight this invisible enemy, as the Minister of Defense has told us. It's an invisible enemy. So we really have to treat it almost like we are at war with something that we just cannot see. And it reminded me the other day of what it may feel like for people who are living on the Gaza Strip, to live in the daily and the momentarily interruption of the sense that your life is under threat. And that's going to cause huge amounts of trauma. And I wanted to say that people have to use whatever psychological, psychosocial support they have available at this point in time to be able to support them through this difficult time, because we are going to start seeing more and more people having negative mental health outcomes, which is going to make it more difficult for us to manage the spread and the doubling of this virus in South Africa.
And just lastly, an advice on how to avoid conflict and still maintain the structure in your new routine. So people already, what's going to happen is, especially if people are in households where we are now suddenly confined, we are going to have to rework how we connect with one another. And conflict is inevitable to come up. I mean, we've started hearing through the media various angles around looking specifically at the amount of domestic violence which may increase, the amount of abuse which may increase. So those are things that are very real. But to move away from what is meant to be the exception rather than the rule in terms of the abnormality of the situation, I'm going to talk to the point of a household that is fairly normally structured and is fairly well connected in terms of the sense of connectivity and affectivity in the household. I mean, even those particular family units are still going to struggle with conflict. People are spending a lot more time together with each other, whereas in the past people would have had reprieve going to work or reprieve doing something else, or maybe even just being able to exercise, to be able to do their usual yoga. So people are out of their depths in this particular point in time. We all are going to be a bit wired, a little bit thinly stretched, and that's going to make it easy for us to have conflict. My encouragement is be patient, be kind to one another, understand this is an unusual situation. We all have to make behavioral adjustments at this particular business unusual situation if we are going to survive this pandemic.